Hello there, this is KousikRajendran, Director of Sparta Systems. And right now you're seeing our product called as AAYUWIZ on the screen. So AAYUWIZ is a very simple EMR system which has loaded with features like remote patient monitoring, smart lab, and smart RX module, along with various other modules that have been incorporated with. Today I would like to show a very simple case study of a diabetic patient visiting a diabetic doctor, where he's just prescribing the medicine and just prescribing a lab later, along with how this remote patient monitor is going to work for him. So let's see how that works. So before that, I would like to just show you a simple UI of us, where it lists the list of patients available with the doctor. I can just go pick the patient who is visiting me. So now I would like to first know about the patient before even I'm gonna prescribe him. So I just logged into the open the patient record. I'm just looking at various data trend available with them, along with all the history information, all the laboratory information, where I'm able to navigate. After getting clear understanding, what I can do is I can just go back, and then I'm planning to first take an ECG because of his condition out there. So what I would want to do is, first I want to do a initial procedure type for some reason that patient has, and I would like to do a test of telemetry and pacemaker analysis. So I'm just submitting it, that's it. So once I'm done, what it asks is to preferably ask me to select any of the data center of diagnostic center, sorry, that is available with me. Either it can be my favorite diagnostic center, or internal department, or even the external diagnostic center. So I would be able to select some of it and give some reason for the uh, test, and do ASAP, and just order the diagnostics. So this way what happens is, it sends the copy of the patient record that has been done by doctor today to the lab, and to the copy of message to the patient too. So that way the lab and the patients are well connected, and the patient doesn't need to carry anything with him when he's going for the test to the same lab that has been preferred by doctor. So once this is done, what happens is the patient goes there, takes the test, and get back to the doctor. And doctor, after seeing that, again he pulls up the RX or medication if he wants to prescribe any. Okay, we call it smart RX, but why? Here is what it is. So think that I want to just add a medicine called as insugen, or let me go with some medicine. Yeah, insuman. Okay, so insuman is a medicine that I'm planning to prescribe. Oops, what is it saying? The drug has been identified as allergic to the patient. So where is it? Here you see. So what happens is, in this allergic history, so we are noting down all the allergic medicines. So for example, how this happens is, a doctor can, while stopping the medicine abruptly, he can go and select any of these reason and mark it as allergic or something. So when he does it, so later whenever doctor is prescribing the same medicine, it pops up. And also we have an intelligent module called as you know a detailed display panel, where whenever you are selecting the medicine, it kind of just shows up all the information in this panel. And you have history of medication too. If you want to just continue, you can just click the repeat button, which continues the medication cycle. This is about it, and after which we are really excited to see our new module that has been in our lab so far, and now we are also devising our own hardware. So this is called as monitoring, which has two different scenario, which is self-monitoring, and then the clinical progress. Self-monitoring is the one, like for example, today your patient visited, you asked him to do ECG, and you're prescribing some diabetic drug like insulin or something, and the patient goes back. What happens after it? You are giving a cycle to do a test and then ask him to take the value. So the patient goes back using our Sparta hardware. He takes the test, and then just like that he plugs into TV, or and with a GSM SIM card or something. So the data is collected from that device and will be pushed over IWIS data center. So this data center here will calculate, and you'll see all these value pre-populated with the patient's data of the day, and then the doctor will be notified intelligently. If there is any deviation from the norms, then yes, of course, the doctor patient will be automatically scheduled for an appointment and will be intimated. And of course we are working with another module called as video collaboration, like just any other video call, where a doctor can easily talk to patient immediately and take care of the issue. Yep, this is where we are working on. We are still having some of the hardwares developed in our labs, and rest of the modules are functioning properly, and it is available with our beta clients too. Thank you.